Struggling with weight management? You're not alone. But what if there was a groundbreaking medication that's changing the weight loss game? Meet Wegovy. In this video, we'll dive deep into everything you need to know. We'll cover how it works, who it's for, what side effects to look out for, and share some practical tips for success. So, if you're curious about this new option, stay tuned for the full breakdown. First things first. What exactly is Wegovy? Wegovy, which is the brand name for a medication called semaglutide, is officially approved by the FDA for chronic weight management. It is specifically designed to help adults who are dealing with obesity or those who are overweight and also have at least one weight-related health condition. This could be something like type 2 diabetes, high blood pressure, or high cholesterol. It's important to understand right from the start that Wegovy is a serious medical solution, not some kind of magic pill you see in late-night commercials. It's a tool, a powerful one, but still just one part of a bigger picture. So, how does it actually work? Now, let's talk about who is a good candidate for Wegovy. Generally, it's prescribed for adults with a body mass index, or BMI, of 30 or higher. That's the clinical definition of obesity. It can also be for adults with a BMI of 27 or higher, which is in the overweight category. If they also have a weight-related medical problem like the ones we mentioned earlier, however, and this is crucial, Wegovy is not suitable for everyone. There are certain medical conditions or histories that might make it unsafe for you. That's why you absolutely must have a thorough discussion with your doctor first. They can review your health history, assess your specific situation, and determine if it's the right choice for you. A personalized approach is essential to ensure both safety and effectiveness. If your doctor decides Wegovy is right for you, how do you use it? It's a once-a-week injection that you can administer yourself at home. You can inject it just under the skin in your stomach area, your thigh, or your upper arm. The process is designed to be straightforward. Typically, you'll start on a very low dose. Then, over several weeks or months, your doctor will guide you to gradually increase the dose. This slow and steady approach is really important because it helps your body get used to the medication and significantly reduces the risk of side effects. Another key tip for safety and comfort is to rotate your injection sites each week. So, if you used your stomach one week, you might choose your thigh the next. What kind of results can you realistically expect? Well, the clinical studies are quite promising. In a major trial that lasted 68 weeks, patients using Wegovy combined with lifestyle changes lost an average of 10 to 15% of their starting body weight. That's a significant amount, but it's vital to remember that these are averages. Individual results can and will vary. Your success will depend on many factors, like your starting weight, your genetics, how closely you follow your diet and exercise plan, and most importantly, your consistency. Consistency is truly the key. Wegovy isn't a passive treatment. It works best when you are actively participating in your own health journey. By making sustainable lifestyle changes, like any medication, Wegovy does have potential side effects. It's important to be aware of them. The most common ones are gastrointestinal issues. These can include nausea, vomiting, diarrhea, and constipation. For many people, these side effects are most noticeable when they first start the medication or after a dose increase, and they often lessen over time. There are also some rare but much more serious side effects to be aware of. These can include pancreatitis, which is inflammation of the pancreas, gallbladder problems, or kidney issues. It is absolutely critical that you report any new or unusual symptoms to your healthcare provider immediately. Don't wait or try to tough it out. Open communication with your doctor is your best line of defense. So, how can you maximize your results and get the most out of your treatment with Wegovy? Here are 5 simple but powerful tips. First, Stick to a healthy, balanced diet. Focus on whole foods, lean proteins, and plenty of fruits and vegetables. Second, make regular exercise a non-negotiable part of your routine. Find activities you enjoy so you'll stick with them. Third, track your progress. This could mean monitoring your weight, your food intake, or how you feel. It helps keep you motivated and accountable. Fourth, stay hydrated. Drinking plenty of water is always important, but it can also help manage some of the potential side effects. And fifth, and most importantly, follow your doctor's instructions to the letter. Take your dose as prescribed and never change it without consulting them. To wrap things up, Wegovy can be a powerful and effective tool for weight management, but it's not a standalone magic solution. It's a medical treatment that requires commitment and a partnership with your healthcare provider. The most important step you can take is to have an open and honest conversation with your doctor to see if it's the right path for you. If you found this guide helpful and want to learn more about different medications and health topics, please give this video a like, subscribe to our channel, and follow us for more. Thanks for watching.